Continue to follow breaking news tonight at Kootenai Health. A U.S. Army medical team is now at the hospital helping them deal with this crisis of COVID patients. Right now, our Mark Hanrahan and Amanda Rowley are in North Idaho. We begin with Mark. Health officials there saying now even this help may not be enough.
That's exactly right, Whitney. And first off, I feel like we should explain what crisis standards of care means. If you're not familiar with that term, maybe at home. What it means is during normal times, under normal circumstances, the hospital here at Kootenai Health would be expected to provide a certain level of care to patients. What they're saying right now is they're so overwhelmed, their resources stretched so thin, they may not be able to provide that level of care to all patients. So maybe if you wind up in the ER for something not COVID related, your wait time is going to be longer. If you are admitted, you might be treated in a hospital hallway or a classroom perhaps. You mentioned that team of DoD personnel. There's about 20 of them. They arrived here on scene a few days ago. They're expected to be here for at least 5 weeks, helping out this overwhelmed and just really exhausted staff at Kootenai Health. And Amanda, Kootenai Health held their own press conference today where they addressed this overflow space they've set up for COVID patients. Right. It's this building behind us here, the Health Resource Center, and that is now filling up with COVID patients.
It is. So in total, they have 22 beds in that overflow space. It's actually a conference room that was turned into a patient care room. That total right now today, 11 of those beds, 11 of the 22 beds are being used by COVID patients right now, and they are. There's a worry behind what they were saying today. They're distressed. They're pretty slim on staff as well.
Right.
So, yeah.
And the contingency, if this fills up, we may be talking field hospital down the line.
We could. So
right.
The chief regional operations officer said that they aren't in current discussions, but expanding to a field hospital will depend on whether or not the overflow center reaches max capacity.
Sure.
But even then, they're like, we're not even at that point yet. If it reaches max capacity, they're going to be looking to community support, other area hospitals or clinics that can help out and provide that bed space.
One of the big concerns here, of course, is the low vaccination rate. It's sitting about 40% for some context, Spokane County, roughly 60%, I think 59% as of yesterday. So neither is great, but 40% is especially low. And on top of that, kids went back to school yesterday here in Kootenai County. There's no mask mandate for students in the classroom. There's no vaccine requirement for teachers in the classroom either. And staff here, they're concerned about that.
They are. I mean, right now they're treating 115 COVID patients, and they're saying that's well above their capacity.
Right.
And they also mentioned they're worried looking ahead now. We've had the Labor Day weekend holiday. They're worried they're going to start to now see patients who may have been infected over that weekend starting to come in. So they're just kind of waiting at this point.
Yeah, one of the things that struck me yesterday, we heard from the director of the Idaho Department of Health and Welfare. He was pleading with people, number one, to get vaccinated, and number two, he said, look, avoid risky behavior. Not even talking about COVID, like wear your seatbelt, take your medicine as prescribed. Try not to need to come to the hospital because right now there's not really space at the hospital. My goodness.
Space or staff. They need staff, right?
Yeah, very good points. All right, Amanda, thank you very much. That is the very latest from Kootenai Health. For Amanda Rowley, I'm Mark Hanrahan. Tom and Whitney, now back to you guys.
Thank you so much. We certainly know that this is an ongoing situation, and as all the health officials have said, after this long extended holiday weekend, the return of school, they fully expect those numbers to keep going up.
Yeah, and I'm glad that Mark explained what crisis standards of care is that you just, a normal person going in with a normal problem may not get the normal care that you're used to because they are so overwhelmed right now with COVID patients.
It is a humongous deal.